Both Speed's and Yergason's tests can be used to detect superior labral and slap tears and also bicipital tendonitis. And with both of these tests, when they were first created, they were purported to be good at detecting bicipital tendonitis. And they certainly can detect bicipital tendonitis. However, more recent evidence suggests that both tests are actually better at detecting tears of the labrum than they are bicipital tendonitis. To perform Speed's test, the patient is going to be positioned in either seated or standing. I'm going to be demonstrating this with the patient in seated. The patient's then going to be instructed to bring their shoulder into just short of 90 degrees of shoulder flexion. So there's no exact angle that the shoulder has to be. It needs to be less than 90, but about 70 degrees of shoulder flexion, like you see here, is sufficient. Also, the elbow needs to be straight, as you see here, and the palm is facing upward. The next thing is the PT is going to stabilize the shoulder, and I'm going to use my index finger, and I'm going to firmly palpate the biceps brachii long head tendon, as you see right here. And then the patient's going to attempt to keep their shoulder in this position while the PT applies a manual force downward at the wrist. So it's basically just resisted shoulder flexion. So just like this, while you're palpating the long head of the biceps tendon. And a positive Speed's test is going to be familiar pain reproduction in the bicipital tendon or the bicipital groove. Now, these psychometrics right here were determined for detecting slap tears specifically, not for bicipital tendonitis. That being said, the sensitivity is terrible at 32%. So you would never use Speed's test to rule out a slap tear. If you wanted to rule out a slap tear, there's better tests like biceps load test 2. Notice the sensitivity is all the way up at 90%. This would be much better, therefore, to rule out a slap lesion. And even the specificity of this is 97%, much better than what we see for Speed's test. That being said, most programs will elect to omit Speed's test because it has poor psychometrics in favor of teaching the biceps load test 2. Because the sensitivity and specificity are so high, you can be much more confident in ruling down and ruling up a slap lesion. If you want to learn more about biceps load test 2, I have this video on my channel. Let's take one more look at Speed's test. So we position the patient's shoulder in just short of 90 degrees of flexion with the elbow straight and palm facing up. I'm going to stabilize the shoulder and palpate the long head of biceps tendon with my index finger, and then we're going to have the patient perform resisted shoulder flexion. And a positive test is going to be familiar pain reproduction in the bicipital tendon or the bicipital groove. Thank you for all your support. Be sure to check out my Instagram for cool science and not science stuff.